Welcome to our weekly Africa CDC press briefing. This section covers reports and highlights updates on the public health emergencies across the continent. And this section is usually brought to you by the acting director of the Africa CDC, Dr. Ahmed Okwe-Ouman, as our regular host for this section every week. Today's briefing, as usual, is going to focus on the key situations on the continent, including the COVID-19 situation, the current status of the COVID-19 situation. In addition to that, there'll also be updates on the Ebola situation happening currently in the Republic of Uganda, and then other public health emergency in other countries that are currently taking the attention of Africa CDC in terms of response. And also the director will highlight key initiatives and support Africa CDC is currently offering to member states in these outbreaks and public health emergencies. And then there will be highlights from the upcoming CPHIA, that's the second Continental Conference on Public Health for Africa. The director will also highlight on the preparations because that conference is just happening in a matter of a week. So colleagues, welcome. And as usual, after the director's briefing, we're going to move into the question and answer section where you're able to interact with the director through your question and answer. So until we reach that bridge, let me turn it over to the director for his briefing for this section. Dr. Ahmed, over to you for the briefing. Thank you.
Thank you, Nick, and good morning, good afternoon, good evening, depending on where you're joining us from. And welcome to this briefing on World AIDS Day. That is also another pandemic which continues to ravage the continent. And it's important that we continue to remember that we have not yet brought it fully under control. So today is World AIDS Day, and let's remember those who need our support in as far as HIV and AIDS is concerned. So today I would like to share with you 5 different outbreaks on the continent that are of public health importance. The 5 are, I'll start with COVID, then I will do Ebola virus outbreak in Uganda, then I will do the multi-country Mpox outbreak, then cholera, and finally Crimean-Congo hemorrhagic fever. Let me start with COVID. And when we look at the continent, the total number of cases that we've documented to date from the beginning of the pandemic is just over 12.1 million. And this accounts for 2% of the global number of cases of COVID that have been documented. We have unfortunately lost 256,178 people here on the continent of Africa. And this gives us a case fatality rate of 2.1%. The number of people who have passed away here in Africa constitutes about 4.1% of the global deaths. It's important for us to remind ourselves that our 2.1% case fatality rate is nearly double that of the rest of the world. So it is important that we bear that in mind as we continue to control the COVID-19 pandemic here on the continent. When we look at the total number of cases reported to date, there is 5 countries who make up 60% of the number of cases, and that is South Africa with 33%, Morocco with 10%, Tunisia with 9%, while Egypt and Libya each has 4% of the total number of the 12 million cases that we have documented here on the continent. When we look at the trends for week 47, and that's the week running between the 21st and the 27th of November, and then we compare that with the AP week 46, the situation is as follows. In this AP week 47, the number of new cases we've documented on the continent is 6,993. This is a 23% decrease from AP week 46. While the highest proportion of new cases we are seeing from the southern region, which has 51%, eastern with 22%, northern region with 20%, while central has 4% and western region has 3% of the new cases that we've seen during AP week 47. The countries that are reporting the highest number of cases during this week are South Africa with 3,491 and Morocco with 1,081. Unfortunately, we have also documented a total of 37 new deaths, which is again a 26% decrease from the previous week. So this week 47, we are seeing a drop, significant drop, in fact, of 23% in the number of cases, and also a significant drop of 26% in the number of new deaths. For the 4-week trend analysis, when we look at the period the 31st of October to the 27th of November and compare with the month before, we see that we have documented an overall 7% increase in the number of new cases on the continent. So for the month, it is an increase of 7% in the number of new cases. While when you look at deaths, we see a 3% average decrease during this analysis of the month. Overall, therefore, we have observed an average increase in the new cases over the last 4 weeks on the continent, but we continue to monitor with our member states to ensure that we are keeping the tools that are working for us. These are public health measures, vaccination, and surveillance, particularly genomic surveillance, because we need to be sure that there are no new variants or subtypes that are coming into circulation. For vaccination, to date, we have had 1.035 billion doses of COVID-19 vaccines delivered to the continent. Out of these, we have administered 806 million, which gives us a consumption rate of 77.9% for the doses that we have received. You will recall that we are progressively moving to the new denominator of 12 years and above for reasons of we do not vaccinate below 12 years of age. So we want to be sure that we are getting the right proportions and those figures are being reworked based on the newest figures we are getting for populations that are 12 years and above. But using the previous denominator of total population, to date, we have a coverage of 26.1% of the total population, making it 366 million people that we have vaccinated here on the continent of Africa. As we continue to roll out the Saving Lives and Livelihood initiative across the continent, we are seeing a boost in terms of increases in vaccination rates, in terms of better uptake of vaccination by populations here and communities here on the continent. And we are also seeing increase in the number of doses that we are replacing as we continue to vaccinate our fellow citizens here on the continent. In fact, just for last week, we have administered nearly 2.6 million doses. That is just in the past 1 week since the last briefing. Nearly 2.6 million doses have been administered. We've also seen an increase in those who are taking booster shots. and we now stand at 3%, which is 43 million individuals who have received their booster shots across Africa. We continue to work with our member states to increase vaccination rates, because we are very keen that we get as close as possible to the 70% that we had put as a target. So this is COVID-19 update. And now let me shift to the second public health event of significance on the continent, and that is the Ebola virus outbreak in Uganda, specifically for the Sudan strain. Since the last briefing, to date, one new confirmed fatal case of Sudan virus was reported in Uganda. You recall that last time we did not have any new cases, but this time the case which was confirmed at death has made us start reevaluating how that particular outbreak is going on in the country. The confirmed death was the result of a stillbirth of someone who was a survivor of the Ebola outbreak. So an individual who had survived the outbreak and had gone through her days of observation and had been released, then delivered stillbirth, which was positive for this particular Sudan variant of the virus. The survivor is currently admitted and undergoing treatment after confirmation that the child, the child that was born at death, the child that died at birth actually had the virus, and we continue to monitor this particular survivor for the time that is required. We want to be sure that the grieving mother is in good health otherwise, and to be sure that she can be able to be reintegrated into the community. It is a sad situation to lose a child and then go back to the treatment unit. Cumulatively, since the beginning of the Sudan Ebola virus disease outbreak, we have seen 142 confirmed cases. We have seen 56 confirmed deaths from 9 districts of Uganda. This means that we've actually been losing approximately 4 out of every 10 people who are confirmed to have this Ebola virus. We are also sad to note that healthcare workers account for about 14% of the cases that have been confirmed, and 13% of the number of deaths that have been confirmed to be a result of the Ebola virus outbreak. The trend still continues as last time, that it is the most active and the most productive part of the population that are affected, and that is persons between 20 and 39 years of age. In terms of contacts, we continue to follow up with the contacts, and right now the follow-up rate is 70% of those who have been identified, and those are about 565 people. The number of contacts who have now completed their 21 days of follow-up and have been released cumulatively stands at about 3,636, which is 81% of the total number of contacts. So the contact tracing is quite successful at 81% of those who have been documented as possibly exposed to a case that has been confirmed. The Ministry of Health in Uganda is working with partners, including ourselves as Africa CDC, to secure the areas where the contacts are, to provide the right information to the communities so that they are able to themselves monitor how their communities are doing, how individuals who have been exposed within the communities, where they are, and of course, those who have been identified as contacts are being secured so that they are not a risk to the rest of the population. So the ministry there, the government of Uganda is doing quite well in terms of securing the areas where we had cases and where we have contacts who are under monitoring. We continue to build the capacity of the different areas of work: laboratory services, infection prevention and control, surveillance, including cross-border surveillance. We are also working with the neighboring countries to ensure that the capacity to be able to quickly identify any case and contain it is also there. And we are doing this as part of our public health response, not because there is any real fear that a case may go beyond Uganda. So for the Ebola virus disease outbreak in Uganda, I can repeat again that the situation is under control, and we are looking forward to start countdown of the outbreak when we are reasonably certain that there are no new cases that have been identified. As soon as the last batch of contacts finish their days, then we will begin that countdown. So that's the second public health event of significance that I wanted to share. Third is the Mpox multi-country outbreak, which is both here in Africa as well as globally. And the situation since our last briefing is that a total of 51, that is 51 new confirmed cases and 4 new deaths of Mpox have been reported in the DRC. This is more than 100% increase in the number of new confirmed cases compared to the last briefing. Cumulatively, here in Africa, we have now seen 1,047 confirmed cases, 202 deaths, which gives us a case fatality rate for Mpox of 19.3%, being reported across 13 member states of the African Union. 3 countries, though, the DRC, Ghana, and Nigeria, account for about 94% of all the confirmed cases that have been reported on the continent. I was recently in the Republic of Korea, and during my visit there, we have concluded negotiations for a donation by the Republic of Korea to Africa CDC and by extension to Africa Union member states, 50,000 doses of vaccines that we have for Mpox that we are now finalizing how they get to the continent, and then we begin to distribute them to areas where it is most needed. And the priority is going to be our health workers in the front line, and then the communities where the epicenters have been identified. So we are very grateful to the Republic of Korea for their generous donation of 50,000 doses of second generation vaccines for Mpox. The fourth is the multi-country cholera outbreak. And since the last briefing, we have documented 10,171 new cases in 4 of our countries, and that is Ethiopia, Kenya, Malawi, and Nigeria. And this is more than 100% increase in the number of new cases compared to the last briefing. Over the last 4 weeks, when we look at the 4-week period, there has been a 185% average increase in the number of new cases for cholera that have been reported across the continent. This is a cause for concern because the numbers have become large in terms of increase and are related to some climatic conditions, including flooding in Cameroon, Nigeria, Sudan, South Sudan as well. Countries that are experiencing flooding are also experiencing larger numbers of those who are being reported to have cholera. As you know, we have a shortage in the vaccines, and therefore we are working with our member states so that we can be able to use other measures apart from vaccines to protect the population and provide them with the necessary treatment when they are diagnosed with cholera. So far, from the beginning of this year, 14 of our member states have been affected with cholera, and we continue to work with those who are having active cholera cases, including Ethiopia, Kenya, Malawi, and Nigeria, as I have reported there. We have technical teams on the ground to support the governments, even as we look for ways of getting more cholera vaccines to the affected areas. Finally, today is Crimean-Congo hemorrhagic fever in Uganda. The government there reports 6 new cases and 1 new death of a Crimean-Congo hemorrhagic fever. And this gives us a case fatality rate of 16%. But the good news is that this is a 45% decrease in the number of new cases since we did the last briefing. We are using the same infrastructure we are using for Ebola virus to do surveillance and monitor the Crimean-Congo hemorrhagic fever in Uganda. And the results are that we are seeing the number of cases going down as the population becomes better at protecting themselves and identifying cases early and avoiding exposure and therefore interrupting circulation within the communities. In terms of other areas, I have 3 pieces of information that I would like to share today. One is it's only about 2 weeks to the Conference of Public Health in Africa in Kigali in Rwanda, and I hope that you have registered and we are going to see you at the meeting. Those who may not have registered, please continue to register. Registration is open. And we have received overwhelming interest, particularly in side events for this meeting. And a full list of that is going to be found on the conference website, www.cphia2022.com. Please do visit so that you can see the list of side events that will be of interest to you, apart from the main conference events. And the side events will begin on the 10th actually of December of 2022, when we'll have our pre-conference youth meeting there. They're organizing a youth pre-conference on 10th and 11th of December in Kigali. So this is the first thing I would like to share about the Conference for Public Health in Africa, and it is youth pre-conference on the 10th and 11th of December. Second is we have been having training for the Bingwas. These are the champions for vaccination in Dar es Salaam, and today is, I think they finish tomorrow. So the training has been very good. We are getting very positive feedback from the young people who we selected to be the youth champions for vaccination, and particularly COVID-19 vaccination. And they are going to be ready to be deployed as soon as we have the training is finished, and we'll have a very strong program for them, and we'll be reporting back here on a regular basis how our youth champions are doing. And we really encourage all of you to be Bingwas, not just for COVID-19 vaccination, which is our primary focus right now, but for vaccination in general and public health on the continent of Africa. The third thing that I have is that we have decided at the Africa CDC to honor and recognize our frontline health workers. Today, I would like to announce that we are going to launch at the Conference for Public Health in Africa the Africa CDC Drasa Award for Frontline Health Workers. Drasa, named after Dr. Ameo, for those of you who recall, in 2014, a Nigerian doctor put her life in the line by securing an individual who had been exposed to the Ebola virus, had arrived in Lagos, and she contained that particular patient at great risk to herself. She contracted the virus as well and died out of that exposure. In recognition of her heroic actions during that time, protecting not just one of the most popular cities in Africa, but also one of the largest countries in terms of population on the continent, we are naming this particular award after Dr. Stella Ameo, and we are going to formally launch it at the Conference for Public Health in Africa on the 13th of December 2022 during the opening session of that conference. We must appreciate the risk, the sacrifice that our health workers are actually exposed to, and we need to make that recognition, make others who are joining this profession feel that they are recognized. In Africa CDC, we recognize them, we appreciate their work, and we are going to have this annual award to be given to an individual who is befitting it from amongst the frontline health workers who are dealing with outbreaks and diseases on a daily basis. So do join us next on 13th of December at the opening session of the Conference for Public Health in Africa as we launch formally that particular award. But I wanted to share with you this good news today before that award is eventually formally launched at the conference. So thank you very much, and looking forward to your questions. Nick?
Thank you, Director, for that very comprehensive update on the public health events that are happening on the continent. As you just heard in the Director's closing of the updates, the Managing Director of Drasa, I believe from the technical team, she's trying to join us. Once she's able to join us, we are going to give her the opportunity to be able to say a few words about the event just within an hour after this briefing. But in the meantime, colleagues, it's now the time for our question and answer session of this briefing. We will continue with that until the MD from Drasa can join us. So there are three ways, as usual, that we send in our questions to the Director on this platform. One of those three ways is you can use the question and answer section of this Zoom platform live. You can go in there and type your question, and we can see it and be able to forward that to the Director for our response. You can also use the raise hand icon at the bottom of the Zoom screen, and then you will be allowed to come to us live. In addition to that, we have got the usual WhatsApp platform that most of our colleagues on this call know. That's the number +251 94 550 2310. I'll read that again. +251 94 550 2310. You can use that WhatsApp number to also send in your question, and then we will relay that to the Director for adequate response. So as I said, we are looking across our screen to see if the MD, the Managing Director from Drasa, has joined us. Once she joins us, we're going to give her the moment. But in the meantime, we will continue with our question and answer. So there are a couple of questions that are coming in from our WhatsApp platform from our colleagues, and I'm going to begin with them as we go along. Let me start with our colleague, Judith Akolo, as usual, from the Kenya Broadcasting Corporation. Her question is on the issue of COVID, and generally she's asking, as we head into the end of year holidays? What are the dangers of a possible rapid increase in cases of COVID-19? And what is the advice from Africa CDC to member states? So Jude wants to know what are the possible dangers that we have rapid increase in COVID cases. Of course, the holiday, many of us are going to be gathering, and what is the advice from Africa CDC? Over to you, Director.
Thank you, Judith, for that question. Any situation that brings many people together for extended periods of time is a risk for COVID and other diseases that are transmissible through close contact and the air. So during the holidays, the holiday per se is not the risk. The risk is the coming together for extended periods of time. And our advice to our member states is this is the time to have a very high sense of surveillance within the communities so that we can be ahead of any outbreak as soon as, or any increase, not just for COVID, but anything else that is easy to transmit from person to person when people come together for extended periods of time. So we are advising that our member states have a good surveillance mechanisms in place, and our response teams are going to be on standby. If anything is detected, then we will be able to respond and contain it quickly. We would like all of us to have safe holidays, and we are looking forward to members of the public also following the advice of their governments and of ourselves as Africa CDC, so that we can be able to have a safe holiday. The important thing here is when we are doing the surveillance, when we are working with our member states to increase and improve their surveillance infrastructure, it is not only for COVID, it is for any other illness that can be able to disrupt our social and economic activities. So we are strengthening the system and not just for one illness. Thank you. Nick?
Sorry, I was speaking with my mic muted. So as you heard in the response, we have to listen to the information from our governments, and as well, there will be guidance on how to go through the holiday from Africa CDC as you should, and you can also access those information. So I'm just informed, as you see on our screen, Madam Nindiola Williams, the Managing Director of Drasa, has joined us. So welcome, Madam. So this is what we're going to do to have you join the section. We're going to end this round of questions. There are just two more of them. We're going to end this round of session, and then we take a break and come to you to mention updates on the events that are happening just within an hour of this briefing. So back to you, Director. The second question is on EVD, and this is from our colleague Esther Nagasi. It comes from in our WhatsApp group. Esther said, what is the latest status on the EVD vaccine trial that was supposed to happen in Uganda? Do you have any latest information on that, and you can be able to share with us? Over to you.
Now, thank you, Esther. We await the government of Uganda to inform us when the clinical trials are going to begin. And as I'd shared last week, really it is the regulatory process that is being completed so that every aspect of the clinical trials have been well covered legally, they have been well covered ethically, and they've also been well covered logistically. So the government is finalizing those, and we are waiting for that good news to be able to come. Suffice is to say that these candidate vaccines that are going to be undergoing clinical trials are a very important step in our efforts as Africa to actually have all the tools that we need in responding to Ebola virus disease, whichever strain that may come. So we are really looking forward to those clinical trials beginning, and we will wait for the government of Uganda to provide that update. Thank you.
Okay, following the ethical principles and all of the legal implications involved, before we have something happening in Uganda regarding the trial for the Ebola virus. Of course, we have to get general information regarding that from the government of Uganda, as the director has mentioned. So just one more last question from your briefing notes, put in here by our colleagues, and then we'll move on to the MD of Drasa for her comments. So this one says, it's from Claire Keaton, and she says, you mentioned the vaccine donation by the Mpox vaccine donation by the Republic of Korea. She wants to know, has there been member states that have been selected to receive these vaccines, as you outlined in your briefing, that there are several member states facing the issue of Mpox? Has there been member states that have selected? If not, what are the criteria for countries to be selected to receive this vaccine?
Yeah, no, thank you. Again, let me repeat that we are very grateful to the Republic of Korea for this very generous donation to Africa CDC for use within our member states here in Africa. We have not yet selected the countries that are going to receive these vaccines, and neither have we allocated the numbers which will go to each country. We are going to be working on that. Our criteria has three very important parts. There's more, but I'd like to share three. One is active circulation of the Mpox virus within a community. So depending on the numbers that one has, we'll be putting that into the calculation. Second is deaths, because the severity is different from place to place depending on the numbers that have been affected. So the number of deaths that a country has faced in terms of those who were exposed to the Mpox virus. And then the third very important criteria that we're going to use is the capacity to be able to deliver the vaccine to where it is required. So of the many things that are there, these three I would like to share. And in the coming days, as soon as we've completed our analysis and assessments, then we will be able to make it public who is receiving, how much they're receiving, and what plans we have in place to get these vaccines into people's arms. We are very keen to use the infrastructure that we've already developed under the Saving Lives and Livelihoods initiative to use that to get monkeypox, the Mpox vaccines to people's arms as well. That's why I was saying that we are building systems, and the systems are going to be used to respond to any outbreak, any disease entity that we may have on the continent. So a little patience. We will come back to you with more details of which countries we have selected.
Very succinct and comprehensive response to that question. The three criteria will be prioritized have been mentioned. So member states will be looking out for that. So at this point, we are going to take a break from the questions. We have one or two of them that have just come in, but we're going to take a break from the questions. And then we're going to introduce the managing director of the Drasa. We're going to introduce the managing director of Drasa to join us and give us a few words regarding this program that the director mentioned just at the end of his briefing. And then we will proceed with the questions for the remainder of the time. So, Madam Liniola Williams, the floor is over to you for a few comments and updates. Your microphone is now open.
Yes, good afternoon, everyone. Good afternoon to you, Director General, and good afternoon, ladies and gentlemen. My name is Niniola Williams, and I'm the Managing Director of Drasa Health Trust. Drasa is a public health organization that's working to build a network of health champions who are preventing the spread of infectious diseases and saving lives through various areas of our work, from education and training to community engagement, emergency planning, and policy change work. Those are our core areas of focus. And Drasa is an acronym for Dr. Ameo Stella Adadevoh. It's named after my aunt, who was the doctor that identified the first Ebola patient in Nigeria in 2014 during the West Africa epidemic. She was a clinician, and as a frontline health worker, she was able to very quickly contain that patient and prevent the spread of the virus in what we know to be one of Africa's most populous countries. So even though she had never seen Ebola before, she was able to do that. And in the process of caring for the isolated patient, she was infected. And she and 3 of her colleagues died in the line of duty. And that ultimate sacrifice is the reason that Drasa Health Trust was born. Throughout her career, she was dedicated to her work, saving lives. She did that for over 21 years, and she was very committed to caring for others. So to celebrate her life, continue her legacy, and ensure that the efforts that led to her death were not in vain, we established the Health Trust as a nonprofit, keeping her memory alive and working towards health security in Nigeria and beyond. It was founded because we believe that one person's actions in one city were enough to protect and save millions of lives. So we believe that investing in health workers, specifically frontline health workers, establishing a large network of them, making sure they have the skills and support that they need, is what will transform our continent's health. And so our core model, which is reflected across all that we do, is working alongside these health champions to strengthen the health sector together, to prevent illness, improve healthy behaviors, and build a safer and healthier country and continent. We know, of course, that frontline health workers are the first line of defense that we have against emerging and re-emerging infectious diseases. They are the health workers that continually put themselves at risk for the rest of us. And as my aunt said regarding her own actions in the face of danger, she did it for the greater public good. And many other frontline workers do the same. And that really must be acknowledged. They face grave danger and such high risks compared to other populations and other groups because they're coming face to face with these deadly infectious diseases as they provide direct services from identification to caring for infected people. And we know that it takes a toll on them mentally, physically, on their personal lives. They often work long hours in under-resourced environments. And we've also seen where sometimes they themselves become the enemy, where they're, kidnapped or physically attacked as they're working in these communities. And despite this, they still continue to serve us. So this level of sacrifice and courage really must be recognized and celebrated. And Africa CDC definitely recognizes the role that these health workers play, which is why training and deployment of frontline health workers is one of the priority emergency response practices for member states in outbreak management. And our mission is very much aligned with the mandate of the Africa CDC and the Africa Union to prevent and control diseases in Africa and invest in our frontline health workforce. We as Drasa are committed to this cause, and we look forward to nurturing more partnerships to support and celebrate these frontline health workers, because we know that the life of just one frontline health worker is linked to the millions of people that they protect through their work. So it's really with great honor and pride that we're here today, that I'm here today representing Drasa to launch and announce the Africa CDC Drasa Continental Award for Emergency Health Workers. We're very pleased to be partnering with Africa CDC on this. And we know that through this, we can celebrate and acknowledge our courageous and committed health workers who are keeping our continent safe from public health threats. Thank you.
No, thank you. Thank you,
very well.
And Nick, if I may add two things here.
Yes, sir.
To this conversation. First of all, Niniola, thank you very much for making time. We know you have a crazy time zone to deal with. That this is part of being a frontline worker. You are now honorarily a frontline worker to us. The second is it is so important that we remember, and not just remember, but we do something about it. The sacrifice that Dr. Ameo Stella Adadevoh, giving your life for work is something that is not usual. It is not common. And not just herself, but 3 other colleagues, because they decided they were going to do it for the greater public good. For us as Africa CDC and the Africa Union, it is our duty to ensure that we not only don't forget, but going forward, we provide our frontline health workers with the tools they need, with the protection they need, and with the motivation to continue doing the difficult work that they are doing. So in a very small way, we are launching the award, the Africa CDC Drasa Award, not so much to remember that she died doing her work, but much more is to appreciate that she was there for us to be able to be that first line of defense that kept that virus away from Nigeria in general, in fact, spreading to other parts of the continent and even the world. So the memory is for the excellent work that she and her colleagues did. And we are intending this award to be annual. We will be making up an open call after the conference so that we have nominations, and we'll have a committee that will go through the nominations, and we'll be picking the most deserving out of the thousands, I believe, that are going to be nominated. And the recognition is really a call to other institutions, to other organizations to do the same. We need to continue recognizing our frontline health workers and then providing them with the support that they need to be able to continue to do the work. So thank you very much, Niniola. Pass our gratitude to the Drasa Health Trust. Really, we are looking forward to this particular award being one of the most important awards in healthcare on the continent in the years to come. Thank you, and back to you, Nick.
Thank you.
Thank you, Aneliola, and thank you, Director, for the additional comments and trying to share with us the significance of why we're going to be having this award in honor of a great hero, I will say, being myself from the West Africa belt. So just around that comment, before that conversation, before we close it up, I think the Director already started mentioning what the criteria or setting will look like in terms of how the award will be going. But one of our colleagues has just come through quickly with this one. James Cheget just wants to know what would be the criteria for the selection of the health champions as the award is going to be launched, and in subsequent years, what will you be looking for specifically in Drasa champions to come? So Niliola, you can take that. Maybe the Director can also add to you on that. So what are the criteria you're looking for, and what are things that you'll be looking for future champions of the Drasa Award?
Yeah, I think it's really what Dr. Ahmed, Director, has said. You know, people who have shown commitment, who have shown passion, who have shown dedication to the work. We know the work is not easy. The work is difficult at times, you know, not just in terms of the danger faced, but the sacrifices that these people are making, being away from their families, having to potentially isolate themselves. And so the criteria will be looking at people who really have shown commitment to this, people who have potentially been deployed to other countries by the Africa CDC to serve and to contribute their skills and expertise to fighting on the front lines of whatever public health emergency that country is facing. So definitely local African leaders who are doing the hard work that keeps the rest of us safe. I think I'll hand over to Director to provide additional details.
Yeah, no, thanks, Niniola. And James, thank you for the question. Some of these details will work out and publish the call, which will have details. But Niniola is absolutely right. We are looking for frontline health workers who excel in what they do. And we will give a lot more detail during the launch in Kigali. And the full criteria is going to be made available with the call that the call will make straight after the conference, so that we begin the process of selection, because we know it is going to be very heavily subscribed. There are many of us in the front line, and there are many of us who are excelling. And we really want to be sure that the criteria captures that very important piece of work. But upfront, someone has to be African and working here in Africa. This is the base. And then everything else is going to come on top of that. But we want to see those who are excelling in their work as frontline workers, keeping us safe here in Africa. Thank you.
Thank you, Director. Quite a good news, interesting one for colleagues who are in the healthcare service and public health. I think it's time that you add more source to your work and let us see what the impacts you're already making over the span of your career as a public health or health professional in Africa. So we are just 8 minutes to the close of our today's briefing. Just to go back to our questions, colleague, just a last round of reminder for the methods to sending question. Though we don't have much of a time, we can always save your question and bring them in subsequent briefing. So you can use the question and answers section on the Zoom stream, as well as the raise hand icon. And like most of our colleagues are doing today, you can come through on our WhatsApp number, +251 94550 2310. So just a question here. As usual, from our colleague Paul Adepuju to Director. Paul just wants to know what is the status of the implementation of the new Africa CDC statute. I was approved in July, February, then subsequently in July in Lusaka. So are there anything that has happened differently? Paul wants to know what is that? Over to you, Director.
Yes, no, thank you. Thank you, Paul. The statute has a lot of significant amendments to it that need to be implemented. And we have begun implementation with the administrative part. That is how we function, the functional autonomy that we have before we go into the more structural issues that need to be implemented out of that statute. So right now we are doing mostly administrative implementation. The next phase is going to be the structural implementation, which means Africa CDC structure is changing, and positions are also going to be changing, increasing in number, and placement across the continent is also going to be different. So that will be the next step in terms of structural. And then finally is going to be the governance mechanisms that are needed to be implemented, including a new governance board, a new committee of heads of states and government. And all this is going to be happening within 2023. But right now, we are implementing fully the administrative changes and the operational autonomy that we've been granted. And we are going next into structure. And then after that, we go into governance. While we are doing that, Paul and colleagues, the work of safeguarding Africa's health is continuing. We have a very smooth transition between the old statute and the new statute, and our work as a health institution of the Africa Union has not paused, neither has it stopped. We continue to implement as we proceed. Thank you.
Thank you for that clear and concise question, Director. And I'd just like to chip in this one, Paul and the colleagues, like the African parlance that say, we plot the new mat on the old mat, meaning, like the Director said, the work continues as the structural changes, administrative changes continue as a health organization. So I think I've skimmed through our question channels and we don't have any new questions coming in. And so we're going to do the usual closing part of the briefing as we normally do. So we're going to start. We have a guest today, Madam Niliola Williams is with us from the Drasa Health Trust. So Niliola, we're just going to take one more moment of your time. You just give a single message to healthcare workers across the continent based on your space of work and what you're looking forward to in terms of the launch of the awards you mentioned. And then we'll come to Director for his 3 key closing points as usual for this. So over to you, Niliola.
Thank you very much. For me, I think it's a message of gratitude and appreciation. Health workers across the continent, especially frontline health workers, as we've mentioned, really do put themselves at risk, making the ultimate sacrifice while the rest of us can remain safe and protected in our communities, in our homes, in our places of work. And so for me, the message to health workers across the continent is to stay encouraged, to realize that you have the Africa CDC, you have Drasa, you have other entities, institutions, and people on your side, advocating for you, celebrating you, acknowledging you. And so the message is really about appreciating them, thanking them for their service, thanking them for their sacrifice, and assuring them that the work will continue. We are here for them, to serve them, to support them, and to ensure that they have all that they need to excel in the roles that they play. Thank you.
Thank you very much, Idiola. Health workers, you've encouraged, and there are people looking out for you as you work, put yourself on the front line. Now it's time for us to go to the director for the 3 key headline points for today's briefing that you want the colleagues from the media to carry to the population. Over to you, Director.
Thank you, Nick. And first, let me say a very big thank you to Niniola for making time and coming here with us to give the good news about this Africa CDC Drasa Award for frontline health workers here in Africa. My first is on Ebola virus disease. The outbreak in Uganda is under control. We, as Africa CDC and the government of Uganda and other partners, are working flat out to make sure that the control that we have of this particular Sudan variant outbreak stays like that. We want to keep the control and eventually declare this outbreak over. Second is Mpox. Now that we have a new name, which is more decent, Mpox, we have vaccines from the Republic of Korea that we are going to be using as a new tool for the frontline workers and also for communities that have been affected. So Mpox vaccines we have received from the Republic of Korea, and we continue to negotiate with others. So you'll be hearing even more good news later regarding the Mpox vaccines. Third is COVID-19 is still here with us. People are still getting infected and people are still dying from it. And we have a very important defense mechanism called the COVID-19 vaccine. I urge all of us to go out there and get vaccinated, get boosted when it is your time, and be a champion, be a bingwa for vaccination, and particularly COVID-19 vaccination, so that we can spend our holidays with much less worry about what effect we will get if we get exposed to COVID-19 during the holiday season. So get vaccinated, urge others to get vaccinated, be a bingwa, be a champion for COVID-19 vaccination, and let us have a safer holiday. Thank you.
Thank you very much, Director. Still a lot of time before you even get closer to the holidays. There's still a lot of time. Today is just December 1. It means you've got several weeks before the holiday to get vaccinated. Be a champion, as he has said. Thank you very much, Director, for making time as usual to provide such critical updates regarding the health emergencies happening on the continent and what Africa CDC as a mandatory organ of the African Union is doing to be able to support member states in response to these critical times or issues that are happening. Again, thanks to our guest, Niliola, for joining us and the Drasa team, and for the good news for our health care workers on the continent and how they are and must be recognized as they put themselves on the line for saving our lives. And to the colleagues in the background, Africa CDC, the AU team, thanks for making all of this happen. And do join us next week. As usual, you heard in the announcement at the close of the director's briefing, CPHIA 2022 is just within 2 weeks in Kigali, Rwanda. Come and join Africa premier and biggest health events as it happen just in our presence, and make your contribution to safeguard the health of Africa. Let's do this next Thursday, same time. That's 12 p.m. East African time. Until we meet again, thanks to everyone, and goodbye from wherever you are. Have a very good rest of the week. Bye-bye.